Welcome to another episode of Tea and Tales, where we share stories, tips, and a cup of tea. I'm your host, Megan Taylor, and with us today is Dr. Hatam to speak about a topic that's so important. It's Pain Awareness Month. So within pain awareness, a lot of people don't think about dental pain, but it's such an important aspect of it. People usually think if the pet is like whining or crying or limping, there's an issue, but we don't often speak about dental pain. So if you can just give us a little bit of information about yourself, your background, and how you became interested in dentistry.
All right. So first, my name is Hatam. I work for Vienna Vet Clinic at the moment. I'm here in Dubai for 3 years. I started early back with horses medicine.
No way.
Yes,
Okay.
yes, I am. And then shifted to the small animal field. I had 2 clinics back home, and then I moved to Dubai 3 years back. The dentistry part began, I think, 3 years back.
Mhm.
Okay. And then I started slowly. And then what pushed me further for that I had a case that needed kind of a composite restoration. I've read that in the books, but I had no idea about it. And then we had like a neighbor, legendary human dentist, aesthetic one. And then I reached out to him.
Inspiration, yeah.
Yes, inspiration. And then I said, that's what made the light bulb on. And then I started to go deep in that. And I went to Denmark to attend master classes in dentistry, and then started to learn more about more advanced treatments. And then now I'm always busy, mostly dentistry. Yes.
And did you do the dentistry for horses as well then? Or there was...
Horses, we did some, but just the
Different.
basic, because it's different,
Yeah,
different anatomy, different. Yeah, but this was a while back. But now I'm basically mainly small animals and dentistry as well. Yes.
Okay, so if you can give us a little bit of information about pet dental and why do you think that pain is so often overlooked with pet dental, or owners' awareness of if their pet's in pain regarding their mouth?
Yes, because it's always subtle. They don't show the pain. They are
Yeah.
very, we call it, they are very professional actors. So even with the worst pain disease, with the even fractured tooth, they are still eating, playful, like they are not showing any pain. But this does not mean that they are not in pain. They are in pain. But thing is, the way of showing the pain is different.
Okay.
And they are predators. So it's their instinct to hide the pain, to hide the weakness. Because imagine a lion on the wild, he will not just sit aside and say, oh, my teeth hurts and I'm not going to hunt today. They are still
they really have to overcome
keep
it. Yeah.
going, So it's just the way that they hide that pain. But it is the same mechanism. They have still the nerve endings to feel the pain. You see the inflammation, you see the infection. So this is 100% pain.
And do you see yourself a difference in the kind of symptoms people come to you if it's a dog or if it's a cat? Do they kind of show the same pain behavior, or do you see a difference even between dogs and cats?
It's okay. So for cats, they are mostly hiding better. Okay,
Yeah, I
so
feel like the
they
cats
can,
really don't show
yeah,
anything,
they don't
yeah.
show. And for example, one of the symptoms will be sleeping more. But anyway, the cat
Cat
is
is sleeping a
sleeping
lot.
like 16 hours a day. So if it's sleeping more
Yeah,
than
okay,
16
20.
hours, who is gonna notice that?
Yeah.
So for dogs as well, they'll be probably chewing on one side, bad breath, and for you can see black and tartar on their top of the mouth, spitting sometimes of some of the food. Pawing their mouth. Sometimes if there is a serious, rarely you will see a decrease in the appetite, but it happens
Well, that's
only.
what a lot of people come
Yeah.
and they're like, oh, I'm so surprised he had dental pain. He's been eating, and they're waiting to see that they would have stopped eating as a sign that they're in pain.
Yeah, so they are still, as I mentioned, it's still in pain. They will still keep going eating because it's their instinct.
Yeah,
They will
not gonna
still
stop,
eat.
yeah.
It's not gonna stop. They have to eat. And similar to us, when we have toothache, we still eat, but
Yeah, we
we
don't
will
waste
eat
away.
in pain, but we will eat, we have to keep going. So bad breath will be the first thing that most owners will notice. And bad breath is not normal. Okay.
That's
So,
what I was going to get
yeah,
into in a few
okay.
seconds, actually. There's a big myth, we go into it a bit more about myths, but there's a huge one, is this concept that people believe that the pets just have bad breath, you know, like it's a cat, it's a dog, of course his breath smells, but
Yeah.
it's actually not normal.
Yes, exactly. And this always comes after, okay, so they are coming for anything else like vaccination, skin disease or whatever. And then you check the mouth and, okay, we have an infection here. We have, we need to do dental procedure. And then the shock comes to the owner. I'm not coming today for that. I wasn't expecting that, right?
Yeah.
So then his or her mind will start to come with similar excuses because of the shock, I don't know, or whatever reason. So so that's comes with like bad breath is normal, but this is not normal. And sometimes they'll say it's just because of stomach acid. I don't know what's the deal about the stomach acid.
I haven't heard that one before. No.
Seriously, okay, I heard this a lot. And sometimes they'll say it's because he licked his butt, you know, but actually butt smells different. So it's not about stomach acid. It's just the sulfur that can come out of the bacteria, out of the blackened tartar that cause that bad breath. And dogs and cats deserves to have fresh.
Yeah, they want to be fresh as well.
breath, you know, similar to us. Okay, so bad breath is not normal. You still need to take care of that. If we leave it, it will become worse for sure.
And it was an interesting point you just said, actually, that a lot of people kind of find out about the teeth secondary to what the actual issue is. So do you find that a lot that people don't really come for the dental check? It's just kind of an add-on at the end, or do you see people still quite proactive and they will book the appointment? I want you to check the teeth. Or is it more of an accidental finding?
The thing is, because I get some referrals as well from my colleagues and other clinics. So yes, I would be booked for like
at that point,
check.
it's already
Yeah, because like there
yeah.
is another vet who saw it and then he's referring that case to me. But usually, like on daily basis, like some statistics will say 7 out of 10 patients that you see. Some others will say 8 out of 10. It depends on the area and needs like dental care. So it is high number. The earlier we take care of it, the better, the cheaper, like so you see mostly cases coming for other things, and then for example, you can see a case coming for eye disease, and then you discover the reason is because of the teeth.
Yeah.
Because especially for these miniature breed dogs.
Yeah.
You know, so because now with the inbreeding, the mouth is somehow compact, so you cannot imagine that the distance between the root of that molar is very close to the eye.
Yeah.
So one of the most common issues with the eye coming from the teeth, you know.
That's a really interesting point that I don't have the answer for, and I'm so glad you're here. So we always say the small animals, the small dogs, seem to have worse teeth, and it's just kind of the breed we say, like the small animals have the bad teeth. Is this because of like you're saying, everything is so compact? Is that part of it?
Yes, because like a small terrier has the same amount of teeth as a big Labrador. But imagine 42 teeth is in that small creature. So it's always crowded. The bacteria and the food can go inside these teeth, cause this bacteria will cause bone loss and then infection, and then we probably will lose the teeth. So early detection is a good thing, because sometimes when you remove a small teeth that is making this crowdness when they are early, let's say this is a pediatric dentistry. So when you say, for example, you remove one teeth to give a room for the other teeth to grow, then you are saving the rest. But if you leave them, you'll lose them all, you know?
It's funny, I think in humans we've become like quite accustomed to that concept. Like you need to remove them, there's too many. But I feel like in pets, owners aren't quite as, just if you told them to remove a healthy tooth to make space, the owners I think are a bit more resistant to this. We're not fully at terms with it compared to humans.
Okay, so the thing is, in humans, human dentistry and veterinary dentistry is quite different. In humans, we are talking about aesthetic, we're talking about saving a tooth, but here we're talking about making the animal comfortable.
Yeah.
Okay, because even if we have to, for example, in some cats with severe stomatitis, which means like inflammation in the mouth, in some cases we have to remove all their teeth. Okay, and then will come the question how they are gonna eat. Okay, so the dogs and cats teeth design is like scissors. Okay, so in the wild they used to hunt and they will eat flesh, right? So these scissors were meant to cut flesh, but nowadays we are feeding kipples, we're feeding soft food. So if you see a dog or cat vomit, you'll see the kibble 70%, 80% as is, right?
Yeah,
so it's
yeah,
not,
it comes back exactly the
yeah,
same.
yeah. It's not crushable. So this means that they don't use their teeth much. So we are comparing like one infected painful tooth to no tooth. Okay, so we have to sacrifice that, remove the teeth, make the animal more comfortable. Only in some cases, and it depends on what kind of client or owner, if he has the compliance, what kind of dog, if he's like a police dog, hunting dog, so he needs every single teeth, especially the canines and all, then we will make our effort to save these teeth.
Okay. So I want to ask you more myths so we can settle it once
sure.
and for all here. So we kind of got into it already, but myth number 1, if my pet is still eating, they can't be in pain. True or false?
That's wrong. That's completely wrong. They are in pain. And you can see that as signs. So, for example, this small inflammation that you can see in the gum that your vet is showing to you, this can be just the tip of iceberg, because we only see only 1/3 of the tooth and 2/3 are underneath. So if you see this some inflammation, that's alarming. If you see this brownish or yellowish accumulation of plaque and tartar on the teeth, that's alarming. You need to take care of that to remove the pain. So they will still eat. It's their instinct. They will be still happy. They'll be, but the thing is, like, they don't show that to us, but we are their advocate to speak for them and and take this pain out. And you can see that actually afterwards. So usually the owner will feel the difference or will know that the animal was in pain.
They got so used to it and they're like, oh yeah, actually.
After we remove the infected tooth or we take care of that, and then they are more happier, they are gaining weight, they are playing again. The ball that he didn't touch like last year, now he's playing with it. And sometimes actually their pain is so severe that it goes sideways. So for example, their behavior will change. It's not common, but it does happen. So like a dog is more aggressive, and then you go to a behaviorist or trainer or try to check, and the issue is that he's in pain. Okay, so if you remove that
to
pain,
start with the medical check.
Yes.
Everyone, we definitely got into it already. Bad breath is normal in pets. True or false?
That's completely false. As I mentioned, that bad breath is coming from the sulfur that comes out of the bacteria of the mouth, and it's not a stomach acid, and it's not because he licked his butt. Okay.
Just to confirm again.
Yeah, again. It's smell is different. Like yes.
This one is quite controversial, actually. Okay. Dental cleaning without anesthesia are safe and effective.
That's quite trendy nowadays.
That's a big thing now.
Yes, and you see it.
And I see the appeal for owners. It's a lot cheaper. They don't have to sedate their animals, so I understand the appeal. But
yes, I understand that as well, and for some people are satisfying to watch that on social media, like when they are like having the dog on a towel and they starts to do this. Yes. Somehow with some music, it's quite like chilling, but on the other hand, it can make more harm than help. And for me, if it's you said it cheaper, but like for me, it's a waste of money.
Yeah.
Okay, so I just had a case recently that a lady went for like anesthesia-free, something that they call, and then she comes. Yes, the teeth looks aesthetically
very superficial,
nice. Okay, it's white, but the thing is, like, the inflammation under the gum is more severe. Okay, so what we need to do, we will have to do it under anesthesia again. So there are several organizations for the dentistry. None of them agreed for this anesthesia-free scaling and polishing. Even the Royal College just released one article recently against that anesthesia-free, because you're missing the most important part, which is oral examination. Okay, so you're just removing the tartar from one side. You cannot remove it from inside. You cannot do oral examination. You cannot do x-rays. On the other hand, which is more scary as well, sometimes they'll have to give some sedative to it, but you're not protecting the airway. Okay, under anesthesia, we will protect the airway.
And what's very scary, a lot of the time, it's not even vets. You know, it is vet sleep.
Yeah,
It's also
that's,
upsetting, but a
exactly.
lot of the time it's not even a vet doing this. Yeah.
Yes, and then so you're not protecting the airway, so this plaque and tartar can go to the chest, So I don't know how we're gonna treat that or go to an endoscopy to remove that, and you will not see this right away. It will take some time to show signs. As well, when you remove this with no water, with no ultrasonic, you are making more damage to the enamel. So, like if it was like a healthy teeth, now it's the enamel is gone, and then you'll have infection more. Probably you'll end up losing the teeth as well.
And you're going for the full dental either way. So just
Yeah. So
skip
like
this
it's
step.
yeah. It has to be under anesthesia. It has to be full mouth X-ray. It has to be full oral examination, because as well under anesthesia you can see a lot. Okay, so you can see tumors, you can see like inflammation here. You can see lots of abnormalities that you cannot do while they are awake.
Well, that's why it's so kind of not unethical, but you're taking people away from the path where they would have gotten these diagnoses or they would have found these kind of problems, and you're kind of letting them believe that something is fixed or nothing has been addressed actually at all.
No, not at all. Yeah.
Okay, can you tell us the most dental problems that you see that cause pain?
Most dental is okay. So dental is like several branches. The most common ones is periodontic disease, which means the infection or the disease of the around the teeth. Okay, and this is very common in dogs and cats. And this you only can detect while doing X-ray. So you do X-ray and then you see the periodontal disease. As well, in cats, they have a disease called tooth resorption, which is a condition or a disease and dogs as well, that the body is trying to get rid of the teeth. Okay, so he's changing the normal teeth to a bone, all right? And this is long process and it's quite painful process. And you only can detect that with proper oral examination and X-ray. So periodontal disease is the champion. Then the tooth resorption is quite common. There's no treatment for that known yet. So the only treatment is to remove that teeth that is causing the pain. Recently, we see a lot of orthodontic problems. And this is like a shout out for everyone who has like a 6 to 8 months dog or cat. Please go for a check, for a dental check, because this is the golden zone that you can treat these like malformation, malocclusion. So you can treat that at that early age. If you leave that, you will lose most probably the teeth later.
Well, that's exactly my next kind of question. Can you walk us through the dental diseases and how they develop if left untreated?
Okay, so it depends on what kind of disease, but let's say the common ones, which is periodontal disease. So first we will start with a tartar, this tartar or a plaque, and then this plaque will harden to a tartar. This bacteria will go under the gum line and then will cause infection. This infection will cause bone loss, and then the tooth will become wobbly, and then probably you will need to extract that teeth to release.
And is there a kind of timeline on like how long these things usually take, or it can really vary on each pet?
Actually, it doesn't take much time because the bacteria is in trillions in their mouth, okay, and it will still be there. So once it reaches under the gum line, it doesn't take much to cause the pain. And we say like 1 year for us is 7 years for them. So for example, if your vet or your initial consult told you, okay, so your dog needs to do dental.
That's crazy. I've just gone there in my mind. Like when you think, okay, and then a year passes and you do it, or 2 years pass and you do it, you've like wasted 14 years nearly of the pet's life, or let's say around that. That's really would never do that for yourself.
Yeah, exactly.
Like 15 years later, I'm going for this checkup. Yeah.
Yes.
Wow.
So imagine like going to the dentist. Okay, so we have this you need to treat, and then 14 years you remember me, like. Exactly. Yeah. So same way. So when when the recommendations comes to dental scaling or polishing, then you need to book it the same week. Okay, not after 6 months, because, and this is even if you want to save money. If you want to save money, not to spend a lot of money, then whenever you get the recommendation, do it, because if the treatment now is just a scaling and polishing, and it will take 1 session of anesthesia and will cost you, for example, X dirhams. Then after 6 months, it will be scaling and polishing and root planing. After 1 year, it will be probably 2 sessions for 1 extraction, 1 scaling. 3-4 years, you might need to see the dentist for probably 3-4 times, and will be very good friends. Okay, and you might need to see the ophthalmologist, okay? And the scary part is that you might need to see the orthopedic surgeon, and they are not
cheap.
they are not cheap, and they are scary people. And shout out to Dr. Mustafa, our orthopedic savior, because especially for these miniature breeds, as we mentioned, it's a compact. The jaw is smaller, but the teeth is relatively big to the jaw size. Okay, so whenever there is infection into the root of that teeth, there is not enough bone underneath. So this infection does not take much time. That makes the jaws very weak, and then jaw can break on its own. Okay, and this happened, and it happens, and even the only way to treat that is just you still have to remove the teeth. You still have to go again for several orthopedic surgeries, which is not cheap. It's not fun. It's not. It carries some pain to it. So the earlier, the better. Yes.
And you've pretty much gone into my next question, which was going to be about how the dental can affect the other organs in the body.
Okay, so let's go. We have to see the body as a whole. It's not sections. Okay, so yeah, I know like there's a dentist and ophthalmologist, but everything is connected. Yes.
Yeah.
So if that bacteria goes under the gum line and it's already reached the bloodstream, where it will go? It will go to the heart, it will go to the kidneys, it will go to the liver, and it will really affect them. And then you will have to treat still the dental problem, So like you are coming back to the dental, as well as you have to. We have to take care of these kidneys and liver, and yes, we can lose an eye because of dental disease that is unnoticed. Usually, we can fracture a jaw out of that. So it's not something that we are just about bad breath, even if you can cope with that. But we are talking about serious matters here.
Yeah, so underlooked with owners.
Yes,
definitely. Yes. Okay, so can you let us know a little bit, how do vets assess pain levels in pets regarding the mouth? Do you have a scale, or how do you usually assess or tell the owners to explain to the owner, like, pain level?
Okay, so pain level is assessed. There are some meters for that pain level, but the thing is, you cannot really tell much only with the consultation. With the physical examination, you see some changes in the color of the gum. So this means that there is inflammation and there is infection. You can see some like plaque and tartar accumulation, but you cannot tell the full picture until they are under anesthesia and you do your oral examination and you do your full mouth x-ray. So
that was exactly. What role do the dental x-rays or advanced imaging, what role do they play in detecting pain?
Okay,
pretty key, I guess.
yes. It's you cannot do dentistry without dental X-ray. Okay, so you're missing like 50% of the job because you see only 1/3, and then 60% are underneath. And most of the diseases, common diseases, 60% are lying underneath the gum. Okay, so no dentistry without X-ray, and it has to be done and to detect that because like if you only rely on the stuff that you see with your eye, you're missing like most of the other diseases that can be there. Now there is the CT is even better. Because X-ray you're seeing like a 2D image for a 3D organ, but like for the CT you see most of it, so you can rely more on that. It's not that common to be used yet, but hopefully with the time it will be more accessible. But it is there.
And for everyone wondering then, you're the perfect person to ask, how often do they need to be coming for dental checks?
At least once a year. Okay, so these are the recommendations. Some cats and dogs, which they have already dental disease, that this will be like every 6 months will be the recommendation for them.
And for the cleanings, or this is going to be case by case?
Most probably it will be a checkup with a session of scaling and polishing, and as well like it will be better to do the X-rays to come on top of any initial disease.
And what advice can you give owners who are worried about, like a lot of people have this apprehension about putting their pet under anesthesia or doing the dental? What advice can you give owners?
Okay, so regarding the anesthesia and scaling, I know it can be scary. However, now with the new modalities, with the new monitors, the anesthesia we use, and luckily in dentistry we don't use this deep much anesthesia, so we use this quick in, quick out anesthesia. So even if things are going sideways, you can easily just like switch off anesthesia and then go with it. So anesthesia is pretty much safe nowadays. Us, like in Vienna, we have all the we'll have like a dedicated nurse to check before and during and after the procedure. We'll do the blood work before.
Exactly.
Yeah.
That's such an important point as well, I think, to do. Like, we can do blood work, we understand the risk, and it's
Yes.
part of the process. Kind of,
Yes.
it's not a separate thing you can choose to do or not. It's part of this.
Exactly. Yes. Yes. So blood work to make sure that all is good. Liver, kidney enzymes, the CBC as well, and then if all good, then we start with the procedure. Nowadays as well, we do it like we introduce the staging for the dental procedure.
Okay.
Which means for the first session we'll do the blood work, we'll do the anesthesia, we'll do the oral exam, full mouth x-ray, scaling and polishing, removing all the bacteria and the plaque from the mouth. And then if there is any extractions or surgery needs to be done, we will do it in another session 2 weeks later.
Okay.
This makes it like 2 small sessions is better than a long one.
Yeah. Okay.
Extractions in dogs and cats are a surgical procedure. You have to remove the gum, you have to remove the bone, you split the tooth into half, you remove the tooth, you clean the apex, you suture. So it is time consuming. You cannot do shortcuts here. Yeah, I know. It's not just pull them out. And it's not just cleaning. It's a scaling and polishing. This ultrasonic is called. Okay, so it is a procedure that it is a treatment in its own. It's not just polishing. You think about, okay, so he will have a nicer looking teeth. It's a treatment on its own. So extraction, it takes time. So instead of doing like 4-hour surgery in a row, we'll do like 1.5 hours here, 2 hours there. So everyone is relaxed. It's less stressful for everyone.
It's a great approach. Yeah. And can you share a case that you have personally seen recently or even long ago that the dental treatment has really drastically altered the pet's quality of life or whole life?
Yeah, actually, I have a good one, and it's quite rare. I had a dog, 4 months old terrier with no teeth at all.
Okay.
None. And although his siblings, he had the full set already.
Yeah.
But he had none. And then, that's pretty rare. Yeah. And then we scheduled the procedure, we did the x-rays, and then all the teeth, like the milky and the permanent, were under not only the gum, it's under the bone. All right?
Okay.
Yeah. And then at that time, I sent the x-rays to my mentor and I told him I had this case. Like usually what you would see, you'll see the teeth is under the gum line, so then you just remove some of the gum and the teeth will erupt afterwards. But under the bone was kind of new to me. Never read it in any books. And then I reached out to my mentor, I told him I have this case, and then he told me I've never seen this in my life. You know?
Yeah, I've never heard of it.
Yeah, you see? So then, when I went to the course in Denmark, we had like, I don't know, 20 people with interest in dentistry, none of them seen it. So then at that part, like I had to remove some of the bone. It was very delicate microsurgery. Yeah,
4 months terrier as well.
Yeah,
so you have to
very small. I had to use like my loops and then like spending like a couple of hours for that. And now he has the full set of teeth, like happy, gaining weight, all good. Yeah.
Oh,
so,
that's lovely.
That was interesting. I should like
case,
have an article written.
Yeah.
Yes.
And can you let us know what innovations or techniques in veterinary dentistry are you most excited for?
And nowadays CBCT for sure. It's the.
Can you explain?
Oh, sorry. Okay, so CT, as I mentioned, it's like X-ray, but instead of seeing the teeth,
you said CT. Sorry, I thought you said CBCT.
It's called CBC, okay. So it's like more advanced. Special for the dental procedure. So this is like you see the image as 3D, so you can see the teeth, like what's behind, if there is any blood supply, so you can have your treatment plan addressed. As well, nowadays we're introducing like root canal treatment, crowns, these gold or silver ones.
And these are all very new developments. How many years, or not how many years, but it's only in the most recent years that these are kind of options or widely available options to pet owners.
Exactly. And nowadays we're using this cam scan. So instead of these, stamps that we used to, even in humans, like we used to do a stamp to make a crown, but nowadays you do the oral cam scan. It's 5 minutes job. You have the lab do the crown for you. 5 days later, you're good to go.
Amazing. And then if you could people want to know, what can they do at home for their pets? Your best tips for people to be able to do at home to look after their teeth so they don't have to come.
Yeah,
they still have to come to see you, but not as often, let's say.
Okay, so that's a good one. And I have really good advice, pieces of advice for everyone, free of charge. So stay tuned. So first one, and the golden standard, is brushing. Okay, so I know it's easier said than done.
Yeah.
So... but you can try. You can try patiently. You can try like once a day if possible, like once a week if you can. Try different flavor of toothpaste, and for sure it has to be like pet toothpaste, not a human pet toothpaste.
Do you see people doing that with the human toothpaste?
Not here, but like in some areas you will hear about this and this. Please don't do that. So and there are some products will have enzymes to it. So these enzymes will help removing the bacteria without much brushing. Okay, so that's one thing. If you cannot do brushing, or if you can but not that often, then the other thing will be water additives. So there are some special products that you will add to the water that can help reducing the bacteria from the mouth. The other thing will be food. From Hills, they have this TD food, and it's not about we are sponsored. It's just a true recommendation. They have this TD dental dry food. So the idea behind it is that the kibble itself are big. Mm-hmm. So it so when they crush that kibble, the tooth or the plaque will go away, and it reaches all the way to the gum line. And this is the most important part, because some of the other product will go like halfway, but this one is quite big that goes all the way to the gum line, so removing all the bacteria and tartar from there. Lastly, treats. There are several treats, but some of the treats can make more harm than good. So my advice is to go to any product that has this VOHC,
right? Yeah,
Veterinary Oral Health Council. So and this Veterinary Oral Health Council, which is a reliable organization, they have a list in their website that tells what's approved and recommended dental products that they can use. So Hills is in the top of their list. Hills TD. They have Plactive water additive.
Yeah.
It has the VOHC. Recently, we have from Verbac, I think it's called Vigident or something like this treats.
Okay.
It's approved by them, VOHC. And the problem with the treats as well, nowadays we can see caries and cavities, which we shouldn't, because they should eat like flesh and it shouldn't come to cavity. But nowadays, because we are giving more treats, and the treats now has more sugar to it.
Right, I was going to say, it should be from the sugar.
Yeah, from the sugar. So now we see different disease than when we...
what are we doing to our dogs?
Yeah, exactly. So then we had to do this like crown restorations and like fillings and all of that, which like in the past was not a common disease. So so you need to be really careful with the treats, because some of the treats can break the teeth. These balls, the tennis balls, can warn the teeth, so you should avoid that and only go with the VOHC.
What's your opinion as well on the big rawhides or kind of big bones that people think are going to help to help the teeth?
Actually, it can help me make more money. You know, like you'll visit me more often.
It's helping someone.
Yeah. So if you want like to support your local vet dentist, like get one of these. Yeah, it can break the teeth. We see that often, and even can break the jaw, the whole jaw itself. Yeah.
Oh, okay. So we avoid those. If you can give just one golden rule about preventing dental pain, what would it be then?
Regular scaling and polishing, like ideally once a year if you can. That will help because dental diseases are progressive. It will not cure in stone, so we have to take care of that. Even as we do brushing every day, but we still have to go to the dentist at least once a year. So early treatment is cure.
Thank you for tuning in for today's episode of Tea and Tales. If you enjoyed the conversation, don't forget to follow or subscribe to us on YouTube so you never miss an episode. Share this video and let us know your thoughts in the comments. Thanks for listening. Oh, that was so good. You're so good at talking.
Thank you.
My God, they were so loud the whole time.
Not bad.
Also, I feel like I was really unnaturally drinking my tea. I kept being like, I was like,
I was watching here. I did not see if Real was actually doing it because we have to get a shot of you. Like,
okay, we'll do it again.
Dr. Hatam did not even sip anything.
Yeah, I was
He was chatting.
stressed.
I was just
That's the one.